Apologies to you, you've heard this metaphor before. My GP trainer called Brian Clark, he worked in Cairn, and he used to say, life is a ball of shit, and our job is to direct people to the shallow end. Which you can have as a motto if you want to. I sense it might not be politically correct. But I sort of developed the metaphor, and I always think of working in healthcare as a bit being like camping along beside the banks of a river, and all these bodies come floating down, and increasingly we dive deep, deep, deep into the river, and we pull out people who are sicker and sicker and sicker. We spend an absolute fortune trying to put them back together again, but we don't have time to wander upstream and look at who's pushing them in. And in my mind, that prevention thing, stopping people falling in the first place, is absolutely crucial. Occasionally I go into hospitals still as a GP, and I walk around and I walk into intensive care, and I see people in their 90s having their lives slowly sucked out of them on ventilators, thinking, what are we doing? We're still spending a huge amount of money at end-of-life care. Do we have the skill set to have this really difficult discussion about end-of-life care, which is where a lot of the money seems to go. General practice has probably only changed really significantly since I joined it in the level of computerisation. We're talking about using technology. We're pretty much entirely dependent on computers now. I mean, we set little targets, we tick our boxes, and the repeat prescriptions come out. I generally do Tuesdays. There's this huge pile of repeat prescriptions. Half the patients I've never met, half the drugs I've never heard of, to be honest. The only thing that keeps it safe is the computer. The only thing that spots these dangerous drug interactions is the computer. We're almost entirely reliant on it for safety reasons. If you ever go into your GP practice and they say, the computers are down, get the hell out of there now. It's the most dangerous place on earth for general practice with the computers down. But we sort of half missed a trick. We sussed out in general practice that if you take a computer system that you get on with and you train yourself locally, and you get the bit that's fit for purpose, that's how you use technology. It's quite interesting that I have really high expectations for the NHS computer program, because if we could actually work and share information, I would know where my patients are up in casualty, I would know across boundaries, across silos where my patients were. It would make a huge difference in mapping the patient journey. But what we learned about technology is it can't be centrally imposed. Healthcare and technology are actually very similar. They're complex organisms, almost like a pigeon. And too much in healthcare, we treat things as targets. We treat little blocks as if they're bricks. And if you throw your brick out of the window of the Department of Health with a certain force, a certain trajectory, in a linear system, you know precisely where your brick is going to land. But unfortunately, healthcare and technology are pigeons. If you set your pigeon free from the window of the Department of Health, you have no idea where it's going to land. So the only way to make this work is to collaborate locally. Health and social care and transport and education and police and schools. You all get together and you decide exactly where you want your pigeon to land. You collaborate. And then when you decide, you put a bit of birdseed there, bit of birdseed there, bit of birdseed there, bit of birdseed there. Unfortunately, the political way of getting the pigeon to land where you want to do is tying a brick to it before you throw it out of the window. So it's not just about the technology, it's how we use the technology, and we use the technology by collaborating locally. I'd like to be an optimist, because I think if any group of people get this in terms of